CDC has been instrumental as far as identifying funds and resources to, purchase equipment and send, equipment and supplies to, again, for our laboratory efforts here on Guam.
The Department of Public Health and Social Services is finally updating its laboratory services thanks to the help from the CDC and its other federal partners. Bureau of Communicable Disease Control Administrator Josie O'Malley says her staff are getting trained and cross-trained to operate new equipment and services that help with the response time in treating certain diseases. They also just received a new PCR machine recently.
Right now, the staff are going through validation testing, and we will shortly, we're anticipating by September, to actually be able to offer influenza A, B, and H1N1 testing. Results could come out in less than an hour. Anthrax, we're looking at probably about 2 hours time, from start to finish.
O'Malley mentions before they had to send specimen samples off island, but now they will also be able to detect foodborne illnesses at a faster rate than what had occurred with the southern schools over a month ago. In the next few months, they will be working with the CT Regional Lab Coordinator on detection kits.
She is assisting us in identifying, the right kit that we need to bring back food analysis capability into Public Health's lab so that we can support a Division of Environmental Health in conducting food analysis should there, be an unfortunate, incident as the incident that occurred in the South.
She adds that will occur in the next 3 months, including water analysis. Meanwhile, with nearly $500,000 being invested, O'Malley says lab rooms are being retrofitted and renovated for more equipment and DNA testing capabilities.
We are anticipating to receive another polymerase chain reaction type of system, which requires a negative pressure setting, for the safety of our lab workers. That will increase our capability to do other types of testing, such as H5N1 bird flu.
O'Malley adds it's been more than 10 years since they had these services, and while their staff of 14 was reduced to only 6 people over the years, she says in the near future, Public Health will finally have an enhanced lab facility for the people of Guam.
We will have that capability. We'll be able to respond quicker. Doctors will be able to diagnose and treat in a more timely manner, and it will result in us stemming the further spread of a communicable disease in our community.